The Morris Center is a transdisciplinary team of professionals who are focused on the assessment for the purpose of treatment of learning difficulties. These learning difficulties can affect language skills, sensory motor skills, emotion skills, mood, behavior, and attention as well, because all of those skills are essential for a child and an adult to be successful in academics, in collegiate, and in the occupational life as well. So the Morris Center's transdisciplinary team is made up of clinical psychology with specializations in neuropsychology. These are the experts who really understand the brain, how it develops, how to assess its strengths and weaknesses, and how to figure out how to help design treatment plans that make the weaker skills stronger. It's also speech pathologists. These are the language experts. They understand how this language system developed, where are the weaknesses, and how do we take a bottom-up developmental approach to build those weaker skills into strengths in the language domain. Occupational therapists, those are the sensory motor experts. They understand visual processing, fine motor skills, gross motor skills. Those are the same areas that can be weak in a child. In addition to having reading, spelling, and writing problems that are language issues, you can have these sensory motor problems. They might affect handwriting skills. They might affect learning to cut paper with scissors, how to use scissors. They might mean the child is later to learn how to tie their shoes. But that sensory motor issue can be strengthened just like the language skills can be strengthened. And then you have the child adolescent psychiatrist, because about 50 to 70% of children who have dyslexia or language-based learning problems, or sometimes it's called a specific learning disability in reading, writing, or spelling, these kids can also have attention deficit hyperactivity disorder. That attention weakness is really more of a focus difficulty. They have trouble actually really maintaining or shifting focus as is appropriate to facilitate learning. So when you take a transdisciplinary team and you have the neuropsychology specialist, the speech pathology specialist, the occupational therapy specialist, and the child adolescent psychiatrist, you now have a team of experts who are cross-trained. That's hence the term trans in the transdisciplinary. They're cross-trained to work together to make sure in each of these areas we're building these skills and making as many strengths as possible, as efficiently and as effectively as possible as well. Kids with dyslexia have not been shown to see words backwards. They do reverse letters, they do reverse sounds, and they might make mistakes in reading, spelling, and speech. Mistakes that represent things like adding a sound that doesn't belong, leaving out a sound that should be there, substituting one sound for the other, repeating sounds that shouldn't be repeated, or reversing sounds, and the child or the adult themselves don't catch it. They make the mistakes and their brain doesn't perceive it. The teacher's brain does, the other adult does, the spouse does, but the person who's made the mistake doesn't pick it up. They're not aware of that difficulty. So the difficulty is very much a multisensory based problem. It comes back to auditory processing and phonological processing. These are terms that are very common today in the educational circles, very common on the news media that we're talking about processing skills, but this is more complicated than just the auditory processing because the basis of the phonological processing is multisensory. It's part acoustic in terms of you're hearing the words, it's part visual meaning you're watching somebody speak to you, and it's part tactile kinesthetic, which means the touch and movement features of the mouth. Those are the three sensory systems that when they work together well, that's what wires and builds these phonological processing skills. So dyslexia by definition is trouble with words, but it's trouble with words that's most likely based in a phonological processing problem. The phonological processing problem is most likely based in a lack of these three sensory systems really building together so we can actually be able to reliably and easily take words and split them apart. If you look at a word and you're trying to read it, you want to figure out the first sound, the second sound, the third sound, and then blend those sounds together without making a mistake. That's accurate reading skills, and that's what we need each child to be able to have, and research has shown we are capable of doing that. The other common mistake or misunderstanding people have about dyslexia is they think it's related to your speech skills, meaning you don't speak as well or you're not as intelligent. Or they think it might be related to your intelligence and that only people with weaker intelligence skills have dyslexia. The research says that's absolutely not true. Many people with dyslexia are average or above IQs. Many different professions are more likely to have a higher incidence or a higher prevalence of people in that profession with dyslexia because maybe that profession taps into a specific strength that these individuals have. Say, for example, architects, engineers, or surgeons. Now, it may be shocking to hear me say surgeon, But surgeons many times are really gifted with visual, spatial, and fine motor skills. That's what their profession requires. They may not be so gifted in their language skills, hence we always hear some people talk about poor bedside manner of surgeons, but it may be that they've targeted themselves towards a profession that maximizes their strengths and minimizes their weaknesses. And when you have more strengths, you have the capability of self-directedly choosing the plans of your life's course and achieving the goals that you set before yourself.